politics, business, sports, arts, music. Mike and Marty on the feed. Mike and Marty. Mike and Marty on the feed. Mike and Marty. Mike and Marty on the feed. Mike and Marty.
Good morning, Bellows Falls and Keene, and welcome to the feed. It's Mike and Marty on her beeper, and today we're here with Becky Legan, and she's going to be talking. She's from Springfield Hospital, and she's going to be talking about nuclear medicine and the diagnostic things they do with nuclear medicine. But first, Marty with local events.
So at the Bellows Falls Opera House, if you missed the Odyssey, then you missed the Odyssey because it's gone.
It was amazing.
Was it good?
Oh, it was really good.
I can't believe it was only 1 week. But anyway, so I don't know what so it's a mystery as to what the actual movie the regular weekly movie. But the classic movie is Tampopo. What is that movie about, you ask? Well, I asked myself the same thing. I tried to read the description they gave, and the best description I can give you was from an AI summary. It is a ramen western. So much like the spaghetti westerns, where the hero came into town and saved somebody. In this movie, which does have subtitles, a truck driver comes into a small town and finds this noodle shop and wants to make this noodle shop the best noodle shop there is. And so there's love and there's food and there's relationships, and it is sponsored by Chris Lumberg. So if you want something, I watched the trailer, and it actually looked like it's pretty funny too. Like there's some funny scenes. So make sure you go for classic movie night tonight. And just reminding everybody, we are winding down to the last of the few weeks for the farmers market. And we know we had a farmers market chair here last week, and she was saying, but this is the time when all of the produce is coming in. So this is the time to hit the farmers market. Remember, they have the cash crop dollars, where I believe, what was it? You spend $20.
You spend $10, they match $10.
So
an extra $10.
It's well worth it.
It's a state program it's a giveaway.
And it's fresh produce, locally grown. That's from 4 to 7 p.m. at the HIDA Green Park. And I think now, last week there were 6. There's only 5 left. And if you're looking for something to do this weekend, it's that time of the year again for Music in the Meadow. It's up in Chester at the the Motel in the Meadow.
Motel in the Meadow, yes.
I couldn't remember the name. I was having a little bit of a brain cramp. Motel in the Meadow. It's 11:30 to 6. It is a fundraiser. The musicians will be Mark Shelton, Sammy Blanchett, The Illusion, which we know locally, John Laware and his band. They play some great classic covers. John and Katie Sullivan, I believe John is a big name in the Springfield area for musicians. And the headliner is none other than Intercept. So if you didn't get enough of Intercept at the old home days, then get up to Music in the Meadow. There's barbecue, there's food and games, raffles, and everything goes to fight breast cancer.
Right.
So it's been, and I think it's growing. I think I know I went to it years ago, but I think now it's become it's interesting
big
event.
Sammy Blanchett is really big in the Ludlow area. He plays all the time in the Ludlow area, and so he's fun to see. And then The Illusion, they've been around since the 60s.
Since a bit of a time, yeah.
And so John Laware and those guys are really good. And then Intercept is just always a hoot. They're great.
They put on a good show.
Amazing show.
They're going to close out the night, and it only runs till 6, so you can get home before dark.
It's my kind of outdoor.
Me too, actually. Anyway, we digress.
We digress. We're old people, Becky, so we have to be in before the street lights come on.
Yeah, exactly. Before they roll the sidewalks up.
So Becky, tell us a little bit about yourself and where you came from, where'd you go to school.
Okay. Well, thank you for having me today. It's a pleasure being here. So I am a transplant. I'm from Connecticut. My husband and I, we moved up here a couple of years ago in pursuit of a quieter life for us and our children. And we love it so far. And where I came from in Connecticut, I worked at some of the larger facilities down there. I got a lot of experience when I was down there, and a wealth of knowledge that when we moved up here and I was looking for a job, it was like, it was meant to be. Springfield was looking for
Oh,
a full-time nuclear tech, and me and Haley, the director, she's also a nuclear technologist. We really hit it off, and together we've been trying to really hammer home what we can offer for nuclear medicine.
Springfield Hospital had nuclear medicine and then went through some things and then sort of didn't have nuclear medicine, and now this is a whole brand new program.
Yes, correct. So in the diagnostic imaging department, the hospital has reinvested a lot of money into it. We have brand new, beautiful equipment. I've been doing this almost 20 years, and like I said, I've worked at larger facilities, and I have never seen so much new equipment and growth and upgrade as I have here in little old Springfield. And when I say state-of-the-art equipment, I mean we have state-of-the-art equipment.
Well, I think that speaks a lot to Springfield's desire to invest in that, to be able to provide the best care for people locally.
Yes.
And not to have to go driving in any other places, but they can come locally. Yep. So can we back up a little bit for those of us that don't actually even know what is nuclear medicine and what does that entail?
So nuclear medicine, it's a branch of diagnostic imaging where we are looking at the function of your organs. We are looking at, metabolism, physiologic things, the difference between us and say CT and MRI. CT is really good for anatomy, bony structures, lung diseases. MRI is really good for soft tissue, ligaments, muscles, joints. So when you think of nuclear medicine, I want you to think of function. We're actually studying how your organs are functioning in real time. And a lot of times we can see things at a cellular level that you can't really see anatomically. Like we can see things before you can see something anatomically, say like on a CT scan.
And is it real time, or is it like an image? Is it an image, or is it something you can see how the
So
blood is?
that's actually a great question. So for example, one scan that we do is called a HIDA scan. HIDA scan is for your liver and your gallbladder. One of the main reasons that we do that scan is to we see how your gallbladder is functioning, or we're going to rule out something called acute cholecystitis. So with that study, what I would do is I would inject the isotope and I start imaging you immediately. So we're getting that information in real time. So I can see as the pictures kind of go along, how the bile is flowing through your liver, how it's going down, into your common bile duct and either out to your gallbladder or down to your small intestines. So I'm actually evaluating how that bile is flowing during real time.
Oh, wow. That's really cool.
Yeah, it's pretty cool.
But is it a sequence of pictures, or is it like a video?
So it's a sequence of pictures. So every scan is kind of different. For the most part. Another scan that we do, everybody knows it as a nuclear stress test, but we call it myocardial perfusion imaging, which is the actual name of the scan. And during that, we take a couple sets of pictures. So we look at your coronary arteries at rest versus stress. So what I do is I would inject the isotope into your arm. You kind of just hang out for about 20-30 minutes or so, and I take pictures, and I'm able to see how that isotope kind of went through the coronary artery at rest. And then when we either put you on the treadmill to stress you, or we can give you a pharmacologic medication.
Or you could just talk about regular life and you could be stressed. Talk about work, you could be stressed. I mean, I think there's options.
Yeah, so during the stress portion of the exam, either after the pharmaceutical injection or, you reach your peak target heart rate on the treadmill, I would give you another injection of the tracer, then I would image you again. And we're actually able to see the difference in perfusion between rest and stress to see if you have any ischemia, to prevent a heart attack. So, yeah.
Wow.
Yeah, it's pretty cool.
It is pretty cool. I mean, that's fascinating, actually.
And then when you're taking the pictures, what is the apparatus? What is it? Like if I'm getting my picture taken, what am I standing like an X-ray, or am I laying down?
So you're going to be laying down. You're laying down, arms above the head most of the time for a stress test. Sometimes other exams, your arms are down by your side, depending on what organ I'm imaging. Like if I'm imaging your heart, the camera heads are going to kind of be like this over you, and they kind of just move to the side. If I'm imaging, say like your gallbladder, your stomach, camera head's just kind of going to be on top of you like that. Sometimes if we do a whole body scan, you go in and I scan you from head to toe, but you know, you're always kind of.
So are you going through like a tube, like the?
It doesn't sound like it.
So
are
you kind of you are. So the nuclear medicine detectors, I have one above you and one below you, but there's also a board that you go through. My machine that I work on is called the SPECT CT machine. So it is a fused nuclear medicine scanner with a full-blown diagnostic CT scanner. So I can use it to do both nuclear medicine studies, fused nuclear medicine studies with CT, and also full-blown diagnostic CT scans as well when we're not using it for nuclear medicine studies.
Okay.
So there's a couple exams that we use the SPECT CT portion, the nuclear, and the CT portion for. One of them is our myocardial perfusion imaging, and the main reason why we use both of them, it's a very low dose CT. That's not a full diagnostic CT. We use it for attenuation correction purposes. That meaning, you know, say you have a man that comes in and has, you know, a very large gut. Sometimes we see just on the nuclear images what we call a defect in the inferior wall. So we use the CT portion to kind of add counts back into that. So we're using to almost subtract tissue per se, so you get an accurate.
So you're not seeing the tissue can give you maybe like false imaging. Is that kind of what you're saying? So you get a clearer picture with the CT portion.
Yes.
Okay.
Yes, correct.
Not false imaging, but stuff gets in the way.
Yes. Yep. So it's going to give us a clearer, more accurate picture. And also another one we use that for a lot of times is what we call bone SPECT CT. Which is really cool because say if you have somebody comes in who, you know, has a osteomyelitis or something along those lines, you know, we come in, we image them, we see something, we do the CT with it as well. We can pinpoint like the exact spot.
And what
the
is an
body where it is.
osteomyelite?
So it's a bone infection.
Oh, okay.
Essentially,
Okay.
it's a bone infection. But I mean, SPECT CT is also great for, you know, fractures. I've had some cases where, you know, I've had patients come in where they have a lesion and they're trying to rule out, well, you know, what is this lesion? And the SPECT CTs come in handy, or even to rule out, you know, loosening of prosthesis. I've had patients come in that have had so many like spinal surgeries and things like that. You know, we do the SPECT CT scan and we can see, yep, these, you know, I'll call them the nuts or bolts or the screws, they're loose and they need to be fixed. So having both anatomic and physiologic imaging is giving the doctor exactly what they need to figure out what's going on.
That's awesome.
Yeah.
And what is like how does scheduling work? Is it referral? What kinds of things would people typically, I mean, you mentioned some, but other things that maybe people can relate to that they might use this for?
Okay. So the main thing to remember is any physician can order this. It does not have to be a specialist. You can go to your primary care provider. So just to throw out a few examples. So like I said, a nuclear stress test, myocardial perfusion imaging, you have somebody who has a family history of heart disease or high cholesterol, has just been having this really weird atypical chest pain. You can go to your doctor and say, hey, doc, you know, I'm having these chest pain issues. I want to get it checked out. I call it the Cadillac of non-invasive heart testing.
Oh,
Right,
Yeah,
right.
Yep.
Yeah.
It's the best way to really evaluate the perfusion through the coronary arteries without going for a cath. I mentioned the HIDA scan.
And the cath is when they actually go
that-
in through.
yes,
yeah,
correct.
okay.
Yep.
Just to make sure
Yeah.
that we're clear
Yep,
on
yep.
what the alternative is.
Yes.
Needles.
Yep. You know, and like I mentioned before, the HIDA scan, if you're having a lot of right upper quadrant pain after eating, you know, they send you for the ultrasound. Ultrasound looks fine. They send you for a CT. There's nothing wrong on the CT. Say, hey, doc, I think we need to see my gallbladder function. It's really the only exam that is going to give you an exact percentage of how your gallbladder is functioning. I mentioned, you know, the bone scans. Even patients who have had a history of, you know, of cancer and, you know, they're out of oncology, go to the doctor, be like, hey, I'm having all this pain in like my ribs or my leg, let's order a bone scan to get it checked out. One that we recently started doing is called DAT scan. That's for Parkinson imaging. There's no cure for Parkinson's disease, but if you're not really getting a really good clinical picture of if this patient could potentially have, Parkinsonian syndrome or, something that's just tremors, we can do a DAT scan and we can essentially image the part of the brain and see if there's any decreased uptake in that part of the brain, so the patient can get on the treatments faster.
I would say early intervention, right?
Yes, early intervention. So my main thing is I want to be able to help the community. I want to be able to bring a high quality service, we have an aging population around here. And just to be able to do that local and close to home with a friendly face, I schedule all my own patients. I get a requisition. When you get a call, the schedule is going to be from me. So you're going to be with me from the start till the end. Yes. I don't rush through things. I sit and I talk with my patients. Where I worked in Connecticut, I worked for 2 Plaintree hospitals. I don't know if anybody's really familiar with that, but it's all patient-centered care. Everything is revolved around the patient. There's no assembly line. I'm going to put on music for you. I'm going to give you the warm blankets. I'm going to give you the pillows. It's a high-class service with a smile.
There you go.
So typically, how long does a procedure take then? It sounds like you could be, depending on what procedure, you could be there for an hour or several hours.
Yes, there's nothing quick about nuclear medicine. Everything takes quite a bit of time. For your nuclear stress tests, your myocardial perfusion imaging, you're going to be with me for about 2 to 2.5 hours from start to finish. A bone scan is a 2-part procedure. So you get the injection in the morning, then you come back a little bit later in the afternoon for the scan. Scan itself can be anywhere from half hour to an hour. A HIDA scan, you're going to be on the table for about 2 hours or so.
Really?
Yeah. Depending on what we see, it could be up to 4 hours.
But you're going to have music, blankets, and and pillows.
Yes.
So I'm just going to point that out. That they're
like
going
a
to be
spa.
comfortable. Yeah, it's like a spa.
Yes. And I always tell my patients, dress comfortably, but yeah, our imaging does take a lot of time. That I will say. It's not going to be like a CT scan where you're going to be in and out in 20 minutes. You're going to be with me for a little bit of time.
And so you talk about the isotope that you inject. What is that? Like what is, because we were talking a little bit about that beforehand.
So it's called a radiopharmaceutical, and there's a few ways we can administer them. You can administer them intravenously, orally, or you inhale it. 90% of the time it's administered intravenously. So what it is, it's an isotope that is compounded with a pharmaceutical. And so each radiopharmaceutical has a different target organ. And there's different isotopes that we can use, but most of the time it's what we call technetium. It has a very short half-life. It's a 6-hour half-life, so it's out of your body in a couple days or so. That's essentially my bread and butter is the radiopharmaceutical. Other than if you're having the CT portion of a SPECT CT scan, all of the essentially radiation's coming from you. So think of the gamma camera as a big radiation detector.
So because that's what the isotope does. The isotope create it's
like glowing in the target, right?
Essentially, you will glow underneath the machine, but you will not glow in the dark.
Oh, you don't think darn it. Darn it. That would be so much fun around Halloween.
Yes. Yep. We actually, they make pins that say, no, you won't glow in the dark. You see like the badge reels like that? Yeah, no, you won't glow in the dark. Yeah.
Very nice.
And what is your generally lag time for scheduling? Like, where are you guys at with scheduling?
So I get an order in. A lot of times I can get you in within a week.
Okay, and that I think that's pretty much key, because I believe that is not always the norm in places.
Yes.
And when you're waiting to find out what's going on, I think time is really of the essence.
Yep. Just a brief example. A few months back, I had a patient, the primary care doctor kind of reach out and ask about an exam because they had an abnormal, scan, and they needed a further image, which is where I was coming in. And, they sent referrals to specialists, and they hadn't even heard back from a specialist to get an appointment yet. I was able to get the patient in, get the patient scheduled, get the scan done before they still heard back from the specialist. So that result was able to get that patient pushed in with the specialist sooner, because it kind of went from being like, okay, to like, okay, they need to
Right, we're
get
not
her, like,
sure
now.
if something's going
Yeah.
on, and now we know something's going on.
Yeah.
So you go to the head of the line per se. That's great.
Yep.
And again, available right here locally. Well, from here, 15-minute drive to Springfield.
Yep.
And again, it's not just the nuclear; it's everything within the scanning. I believe that's when Haley was here. That was the same thing. It was like 2 weeks.
Yeah.
2 weeks tops to get in versus. If you're trying to go to a bigger facility, it doesn't necessarily have different equipment. They have the same equipment. You're just going to have a longer time. Yeah. And that's, to me, if you were waiting to find out your diagnosis, you'd want to get it as quickly as possible.
Yeah. Catching things early and prevention is key. Especially when you're talking about somebody who could potentially have a blockage within the coronary artery. That's kind of it's kind of serious to being able to have a scan quick to see what's going on to prevent a heart attack is huge.
It is huge.
Yeah,
it is huge in anything. Yeah.
So switching gears a little bit.
Sure.
The work you do is really important. It sounds like you really enjoy it.
I do.
And you enjoy being able to do it here.
I do.
If someone else wanted to do what you're doing, where would they start? Where would they go to school? What would they look at?
That is a very good question. So you'd have to find a nuclear medicine program if you wanted to do nuclear medicine. So where I came from, the school I went to closed a little while ago, but there's a school in Connecticut, Gateway Community College. I know Haley is also a nuclear tech. I believe UVM has a program. Other than that, around here, I'm not 100% unaware.
And how long? If it's a community college, is it a 2-year or a 4-year program?
Yep. Nope. They're usually 2-year programs.
Which is another big bonus,
Yep.
isn't it?
Yep.
Yeah.
Yep. Any medical imaging like that, whether it's X-ray or nuke med, they're all 2-year programs, and you can go on to get your CT certification or go on to get certified in MRI. So there's a lot of benefit in medical imaging. There's a lot of different ways you can go, which is really cool too.
It really is.
Yeah.
And you can work anywhere.
Yeah.
You can work anywhere in the country. So if someone is like really not sure what they want to do, this would be a wonderful opportunity to get something that is saleable, and you can be employed, and you can go anywhere.
Yep.
Yeah. That's
And
great.
it sounds like you can pretty much pick where you go, right? Everywhere there's probably a lack of, I think, everything in the medical field right now.
Yeah, it is.
So,
it's really
and if you
important that
can
we
get
people.
a good quality job in a 2-year program, I think that's a lot of.
It's a golden opportunity.
It is a golden opportunity.
That's what I know a lot of, fellow colleagues have done too. You go and you get your initial certification, and then you go back and get your bachelor's degree, and you go back and get additional certifications and things like that, because you kind of
It's sort of like learning on the go.
Exactly.
It's like you can figure out what you like, and then you can shape your own career path.
Yep. And you can do cross training. You can cross train kind of while you're working and things like that. So it's really, it's a great career field. Diagnostic imaging. I will say, anybody who's uncertain of what they want to do, it's a great path to go.
Tricky question. Do you work 4 days a week, 5 days a week? Like, do you do 3 12-hour shifts? How can you
So what I
schedule?
do, I work 5 8-hour days.
Oh, just like a regular.
Yeah, I work 5 8-hour days. Some facilities, if you wanted to, you could probably do 4 10s. I know if you're X-ray or, X-ray and CT, there's a little bit more flexibility there, overnight shifts, and you can work 12-hour shifts, you can work weekend-only shifts,
Yeah.
Yeah, nuclear medicine has more of, I'll call it business hours,
Yeah.
regular
Well,
business
that's-
hours.
a lot of
because
people
the
see that as
time,
attraction.
Yeah.
the time that you have to be there, and also it's maybe not as on the fly scans. It's more of a planned scan, if that makes sense.
Yeah.
Yes, most of the
Yeah.
time it is. There are some things that we do on the fly, but most of it has to be scheduled, and our isotopes are only good for X amount of time as
right.
well.
Makes sense.
But yeah.
Oh, that's interesting. I hadn't thought about that.
yeah,
If it's
yeah.
a half-life of 6
Yep.
hours, you can't just
Yeah.
put it on the shelf and come back next week. And
So
it's-
believe it or not, we
We're
are out of time. So
This always happens.
So to contact nuclear medicine, what is the phone number? Whoops. That's what. Yeah. What is the phone number?
So the diagnostic imaging phone number that you would call is 802-885-7319. My direct extension is 802-885-7327.
Perfect.
All right.
Okay. Well, thank you so much.
Thank you so much.
Thank you.
coming.
Thank you.
See you next week on
Bye,
the feed.
community.
My God, my